بسم الله الرحمن الرحيم. أعزائي طلاب المرحلة الثالثة، السلام عليكم ورحمة الله. أنا دكتور محمد حسن جعفر الساعدي، سأعطيكم محاضرة في الجراحة تحت عنوان Surgical Nutrition. Let us start with some physiological consideration that you need when you study the surgical nutrition. Normal person, and when we say normal person, usually in medical textbooks, usually we refer to a person of average weight of 70 kg, male with average weight of 70 kg. So normal person usually needs 30 kilocalories per kilogram daily. And as this, for average adult body weight 70 kg, the average calorie needed is 2100 kilocalories per day. The energy given by each type of food, we have three essential types of food, which is carbohydrate, protein, and fat. Each 1 gram of carbohydrate gives 4 kilocalories, and each 1 gram of protein gives 4 kilocalories, while 1 gram of fat gives 9 kilocalories. Also, you have to remember that in healthy adults, the normal dietary intake of protein is between 80 to 120 grams per day. And this is equivalent to 12 to 20 grams nitrogen. About the nitrogen, keep in your mind that 2 grams of nitrogen are lost in feces, and 10 to 18 grams are lost in urine each day, mainly in form of urine. The ratio of well-balanced diet is as this. Carbohydrates should be equal to about 50% of the whole diet. Fat about 35%, and the protein is 15%. If the intake of nitrogen exceeds its amount in urine, this is called positive nitrogen balance, which is found in anabolic state. If the reverse, I mean the amount in urine more than the intake, this is called negative nitrogen balance, and it is equal to catabolic state. The balanced diet should contain the following. The water, daily need of water, is 35 ml per kg, which is equal to about 2.5 liters per day. This is the balanced supplementation for average, normal, healthy adult. That, as I said, his weight should about 70 kilograms, and the carbohydrate in the balanced diet in a gram should be 2 grams per kilogram, and fat should be 3 grams per kilogram, protein 0.7 grams per kilogram, nitrogen 0.7 grams per kilogram, sodium 1 millimole per liter, and potassium is 1 millimole per liter. Let us now talk about the malnutrition in surgical patients. The incidence of malnutrition in surgical patients is about 30% of patients with GIT disease, and it reached to 60% in patients with a prolonged hospital stay. The etiology of malnutrition, either due to starvation, that means decreased input, and this decreased input may be due to social causes like lack of diet and poverty and neglected elderly, or due to loss of appetite by chronic diseases, or dysphagia, or due to repeated vomiting, or malabsorption syndrome, like in short gut syndrome, or when there is an inflammatory process, like in Crohn's disease and ulcerative colitis. Also, post-operative restriction of oral intake, like in patients with paralytic ileus, also cause starvation. Paralytic ileus is a state that occurs after many situations when the intestine loses its normal peristaltic movement. After laparotomy, for example, most of the laparotomy, after it, there will be a state of paralytic ileus, and it is different in length depending on the magnitude of surgery and type of surgery. And this will lead to, we ask the patient to take nil by mouth, and the patient, of course, will enter into starvation. Another etiology for malnutrition in surgical patients is hypercatabolism state. That means increased output. The first cause is starvation. Second cause is hypercatabolism, increased output, increased loss, like after major trauma and birth, or after major surgical operations, or after severe acute pancreatitis, or after major sepsis. I mean septicemia, for example. What are the effects of malnutrition on the outcome of surgery? It will lead to impairment of wound healing that may cause burst abdomen. Also, it will affect immunity and cause immunosuppression that will lead to infection. Or it will cause delay physical recovery and hospital stay. Also, it may lead to decreased tolerance to radiotherapy and chemotherapy, and increased operative mortality and morbidity when more than 20% of body weight is lost. How we can diagnose malnutrition state in surgical patients? We have anthropometric measures, which include recent unintentional weight loss more than 10%. unintentional يعني البيشنت ما قاصد انه ينزل وزنه، وعندما تشيك الوزن مالته شاف انه، او احنا تشيكناه شفنا انه فقدان بوزنه عن اخر وزنه السابق مقدار 10%. Second anthropometric measures is body weight is less than 80% of the ideal for height. Third anthropometric measures is mid-arm muscle circumference if it is less than 80% of the average, and triceps skin fold thickness. Another diagnostic measures is laboratory measures, which include first serum albumin if it is less than 3.5 gram per liter. Also, we have to determine the nitrogen balance, whether positive or negative. Also, total leukocyte count if it is less than 1,200 per liter, and impaired hypersensitivity reactions. These laboratory measures we have to assess in order to diagnose the patient with malnutrition. The British Association of Parenteral and Enteral Nutrition introduced what we call it MAST tool. تجمع الأطباء البريطانيين قدموا لنا tool for screening سموها MAST جاية من اختصار الكلمات الآتية. الحروف الأولى للكلمات الآتية: Malnutrition Universal Screening Tool MUST. schedule صار يسمونه MAS tool screening for surgical patient for malnutrition. It divided into 3 parts. First part is the body mass index. Body mass index, it is the weight of any person to the body surface area. Any person can calculate his body mass index by calculation his weight and his body surface area.